Grazie ragazzi, welcome and bienvenue on LinkedIn, on Cannabis Scienza live on LinkedIn. Usually we start this event at 5:30, but today we experienced some technical problems, so we postponed the event, and we hope that now you can see me and Viola, and that this event can can go without further problems.
Thank you for waiting in line. For anyone that has been waiting the solid half an hour, we really appreciate you still being around. And in case, we just remind you that if you don't have time because you already scheduled to finish by this point, you can still be able to see this live afterwards and stream it afterwards, and we'll upload it on our YouTube. So thank you for holding on with us with the glitches.
Yes, it's not our fault. Sometimes technical problems happen. So the important that we managed to solve it.
We made it. I'm very excited, Fabio. Today we are talking about. I am actually presenting a topic that has been long due, asked for, and waited. We touched on this topic as well on our handbook. So, of course, I invite you, if you're curious about all things cannabis, especially the application of what we're saying into the clinic, to check out on cannabisciencia.com/handbook and check out how to get your copy. And without further ado, since we're here and we have the internet, we have LinkedIn, we have the live going on, I'm gonna use this moment and try to introduce this topic. Now, as many of you, I don't know how many people are actually present now in this live, but I know that for anyone watching this, surely they potentially have someone around them that they are directly taking care of, or that they know of, that is experiencing either dementia or Alzheimer. And many of those symptoms are actually similar, especially in the early signs. I think one of the most prominent is really, I don't know if you can see my cursor, but the confusion about time and space is one of the distinctive peculiarities, and this actually has really to do with the function of some of the areas that are so subjected to loss of function with Alzheimer. There is a tendency to withdraw socially as well. And this is one of the topics we will touch as well. Many of the caretakers as well are involved with a level of aggressivity potentially that can come from sudden mood swings. And so there is a variety of symptoms that, as I said, are parallel often between dementia and Alzheimer. And usually the one of the best way to have the certainty of which of the two is actually going on, as one of my professors used to say, was postmortem. Actually, is when we were slicing brains and we could see these things. There is really where you have the certainty of what's going on. This type of feature that you see here with the ventricles pretty much eaten up, it's one of the features that really defines with certainty that the patient was experiencing Alzheimer. And the areas that mainly are affected are the cholinergic areas and the areas of the hippocampus that we touched on already on the other last Tuesday, regular Tuesday, because we had no glitches with Fabio. When he talked and introduced the whole topic of learning and memory, of course, he was obviously pointing at one of the main area that takes care of these functions is the hippocampus, which really is that tiny little banana-shaped right at the center of our brain. We mentioned it last time because obviously I will prompt you, if you haven't, to check out the half an hour that he gave last class, because really it was a great introduction to the class of today, whereas today we talk about the pathological side of, if you will, learning and memory. He really gave an introduction on the physiology of how the processes, for example, of synaptic plasticity are involved. And one of the so in last presentation, Fabio was talking about also differentiating between different type of memory, and this is quite pretty interesting, because really this area, which is very affected in Alzheimer, is one of the areas that are most important for the creation of a new thought, so that the learning part, and of our more short-term memory. Once we consolidate this memory, and it goes from what for neuroscience we define a short-term potentiation, so burst of electricity that at some point, it's like, think when you're like training to learn a new skill. At the beginning it's with a lot of effort, but then at some point it becomes kind of effortless. That moment is when actually there is even a switch in the level of energy that your brain is requiring for you to be able to do those skills, and for the electrochemical gradient that is required, and actually even in the space that memory is really spaced out from one space to the other. Sometimes the experience of many family members or caretakers of Alzheimer patients is that somehow it seems easier to talk about very old memory, but then the things that are happening in the recent times, they seem to not create much impression, and this has to do a lot with the generation in this area. So as I was saying, synaptic plasticity, obviously, Fabio already gave an awesome introduction about this, is linked, being a function of electrochemical gradients, is obviously linked to the importance of a regulation of the endocannabinoid system, because obviously the endocannabinoid system, through a retrograde signaling, being secreted on demand, can manage to either inhibit an inhibitory neurotransmission, or inhibit an excitatory neurotransmission, meaning it can do both. It can inhibit or it can excitate, and so it can help us balance basically synaptic plasticity, meaning that probably has quite some things to do as well in those areas. Now, CB1, so the classical cannabinoid receptors that we think of, obviously are not just involved in the processes that today we're talking about Alzheimer, but there are different pathologies in the areas of neurological diseases that are touched from some of the main functions actually of cannabinoid receptors. One, think of like motor control. I think one of the most clear example of these is how MS patients benefit from THC, or even Parkinson's patients. Appetite, obviously. So it's been THC really has been one of the first claims that have been made, has been as a chemotherapy palliative care for increasing appetite in anorexic patients that are either going through chemotherapy or HIV or a plethora of other pathologies that can induce a loss of appetite and a wasting. We talked about the role of CB1 in memory the other time. And I'm sure you remember as well, for anyone that has been popping around this channel for a moment, we always mention the Vincenzo Di Marzo's definition of what's the endocannabinoid system for. And so even though it's obviously a definition of the 80s, it does not, now we know there are so many more functions of that, but definitely to keep in consideration the sleep, eat, forget, relax, and protect And today we will talk about the forget part, but we will especially talk about the protect part, actually, which is what we're interested on. And so the endocannabinoid system is involved with different stages of how it protects our body. We know that has an important role in our immune system. And so when we look at our brain, first of all, we look at the different role that the immune system can have in the brain, especially in a moment of pathology. Usually the immune system does weird stuff. So as we will see now in the in vitro studies that I will present you, usually when you have a big state of inflammation like this one that we're presenting today, one of the important things that actually we need to start doing is to literally protecting our brain from anything that is coming from the periphery, including our own immune system. So the more our immune system cells can penetrate in our brain, the more disastrous there are, because usually it eats in itself, or it starts plants that actually further degenerate inflammation. So this is one of the things that we don't want. As I was saying just now, it does regulate brain activity because obviously, yes, we think of the activation of the endocannabinoids as a inhibitory related, because the G protein related are either G0 or GI, so inhibitory sort of outcome. But as we said a few times, the complexity actually of this system is that through is in the indirect activation of different systems can also be excitatory. So it really is a modulator in all sense. And this is one of the rationales as well on why we use cannabinoids, for example, for epilepsy. It does coordinate and facilitate the cell repairing, also apoptosis, which it's as simple as teaching the cell how to package itself in the right way to be disposed of in the right way. As you can imagine, if you don't like your pair of old trousers anymore, you can dispose them in a bag. You can dispose of them in a bag and bringing them to the recycle center. That's the correct way of doing them, of taking, getting rid of what you don't want anymore. And the wrong way of doing it is that if you simply put fire in your house because you don't want your old pair of trousers anymore. That is pretty much what happens when our cells go into necrosis, which is the uncontrolled way a cell dies, which is what happens in many pathologies like neurodegenerative, like Alzheimer, where there is a further degeneration of a certain type of cells, so that literally actually die, as we saw in the first image. And then for the last part, yes, of course, not only the endocannabinoid system is involved with the generation of stem cells, but it's also involved actually, and this is from the studies that we look at the role of the endocannabinoid system in the embryo. It's involved in giving directions basically to stem cells to become, for example, neurons, to become glia. So really to indicate what cells need to become. So it's that level of involvement and precisions. Now, the reason that today we're talking about cannabinoids linked to a neurodegenerative disease so important and so difficult as well to treat at the moment, like Alzheimer, because I mean, at the moment, the major pharmacological approach that we have is inhibiting acetylcholinesterase, so inhibiting enzymes that basically break down acetylcholine. So trying to boost as much as we can the acetylcholine in the body. We give some antioxidant, but there isn't really anything particularly resolutive for something as aggressive as this pathology. And we know that this pathology can, I mean, it's a smaller percentage, but Alzheimer can also be juvenile Alzheimer. So it can be diagnosed for people as young as 40 years old or 50 years old. And in those cases, actually, is very, very quick, the generation, even much faster than when we are diagnosed in later age. Luckily, it's not the prevalent type of Alzheimer. Usually, it's a small cluster of people that get the juvenile Alzheimer, but it exists. It can happen, and what can we do? And so it's interesting to note that now I'm talking. It's 2023, just for the last couple of months, and 20 years ago, so in 2003, 20 years ago already, cannabinoids, some cannabinoids have already been registered. IP have been registered for their role in neuroprotection for different uses. So antioxidant properties. I've been asked recently by someone that what really does it mean antioxidant, and I just open a bracket. When we look at, actually in science we call them reactive oxygen species, but this is actually, think of it again, the example of the waste. Basically, our cells, each of our cells has little machines that create energy for us, our mitochondria, and to create this energy, as any process, well, we create waste, and it's as simple as, how do you take care of your waste? Do you recycle? Do you throw everything, or do you not even throw things away? So at some point, your house, it's just like a big mess full of rats. That's pretty much what it means. Antioxidant means that there is a system to take care of the waste, basically, that anyway we're going to produce. This is interesting, obviously, their role for neuroprotective activities. CBD in fact, has been used for damage following ischemia, but this for another moment, because obviously this has not much to do with the topic of today. But it's just to give you an idea of from how long we started to suspect that probably those guys were doing stuff, okay? Suspected so much that someone had the good idea of securing some IPs. And then, lastly, but not for importance, neuroprotection in Alzheimer's disease, Parkinson's disease, and HIV dementia. So let's look at some of these evidences that are brought to these IPs. So this is a bit of a summary of where cannabis or cannabinoids can help: sleep issues, mental confusion, agitation. I would add to this aggressivity as well, where rather interesting study from Israel that was really pinpointing this area. The whole problem with obviously the main point to tackle, which is a cognitive function, and then in general the improvement of mood and quality of life. I would also add that often for example, the acetylcholinesterase inhibitors tend to induce some of the so-called cholinergic side effects, obviously, and so cannabis actually can help in there as well. We always talk about gut health, and cholinergic symptoms usually bring about gut unhappiness. Okay, so cannabinoids in this direction actually help the emptying the bowels, going to the toilet, having more regularity. So all things that actually go in the direction of improving mood, as simple as this can seem. Which cannabinoids? Obviously, the main references are those that are the main cannabinoids, cannabidiol and THC. But as we will look just in a moment, apparently the combination of the two seems to be the most promising type of approach. Now, these are the main references that indicate those uses, and meta-analysis studies. Obviously, we are still at the stage that it depends what we're looking at, but the effectiveness, as in obviously reversing the pathology, we're not even talking at that, but the points for effectiveness are not completely pinned down. So there is effectiveness, but this is not as clear to be shown as we would like in a double-blind placebo-controlled clinical trial. So there is still some limit on how these cannabinoids are used, and at least in the studies that follow this. Now, what is the rationale for the use? Obviously, we just said that cannabinoids have been showing to be also neuroprotective, anti-inflammatory, to have antioxidant properties. All of these are the concomitant problematics that happen in an inflamed brain, like in Alzheimer. As I will show you in a moment, I see that I'm going really slow and we have only half an hour today, so I think I'm taking a bit too much time. Probably the glitches have made me lose the sense of time. But I will just get into this in detail now with an in vitro study. This is a nice in vitro study. Again, if you look at the year, it's 2004. This is coming from the university actually where Fabio was working in Naples, the University Federico II, and looks at an in vitro study with a model of cells that PC12 that have been incubated with amyloid beta peptide, which is in very easy words is a protein that basically is our marker for Alzheimer, and it's the beginning of the issues. Basically, is what we see related. It has these fibrillary structures that start to, think of it like strangles the neuron around it. So it starts to suffocate really the neuron and induce basically cytotoxicity, toxicity inside the cell. So what they're looking at is whether cells that are incubated with this amyloid beta can get some sort of rescue with a co-incubation with cannabidiol. Obviously, on one side they see only what happens without doing anything, and cell viability is extremely reduced by the presence of amyloid beta. But CBD show very interesting properties directly going against the amyloid beta peptide. So they went a bit further with this study, and they look at where CBD was working to induce this effect. And this is where really I think the fascinating area shows up. So CBD, as many of you know, it's like the perfect pleiotropic molecule, meaning that, I mean, it doesn't just go on CB1, okay? It goes on many, many different targets. Some of these targets are also the so-called nuclear receptors. So when you think of receptors, this is a cell, it's like a ball. The receptor usually it's on the membrane, so it's the lipid bilayer that is outside. And usually, yeah, I'm a molecule, I'm CBD, boom, I'm CB1, and boom, and something happens on the membrane of the cell. But the really cool thing about nuclear receptors is that these guys are actually inside the cell, and they manage to be just outside the nuclei, meaning the thing that is closest to our genetic material. So those receptors kind of work like transcription factors. What does that mean? It means that those guys can give direct instruction to the gene on create this protein. We don't want that. Like, we can give direct instruction to the genes. So there is basically, this is how you have epigenetics. This is how you can from an environment modulate the genes pretty much, okay? And this is super interesting because cannabidiol can go directly to these guys and signal, hey, we need to do something against this other protein. And these PPAR gamma actually are the one that manage to trigger an inhibition in the production of this uncontrolled production of amyloid beta, which happens in the brains of those suffering with Alzheimer. This is also another very interesting characteristic also observed in the study. because with the inhibition of this hyperactivation, basically hyperphosphorylation is that it's an hyperactivation of this tau protein. Again, this tau protein is a bad guy. Okay, you see it related in the market as well, not just of Alzheimer, but even for the Lewy bodies in chronic traumatic injuries. You see it related with Parkinson's as well. So this is amazing. So the increase in cell viability that they managed to observe was directly related to the activities that CBD was doing. And then this last one obviously cannot come from the in vitro study because they cannot know whether the cells have more or less memory, but it comes from the study that I'm about to show you, which is a summary of in vivo evidences. These are on rats and mice. Sorry, these are, yes, on rats as well. And so this is a summary of different studies that looked at the use of, they looked at model of Alzheimer in different animals, and then they looked as well at different composition that could be administered. And I think really what's striking here, and we go back to the summary that I was showing you before. Sorry, just to give you an explanation, what it means to reduce gliosis. It means to reduce basically the inflammation of the glia. Fabio gave the other time, I think, a really good intro to the importance of glia. We have been talking as well about also CB2 role and glia, and basically think of it like the kind of really like the immune system, like the good guys in our brain. But the problem is that when the good guys are inflamed, they start to do wrong things, so they go as well in inflammation, and so this is something that we want to reduce. I think this is really the important take-home message, of this slide, which is this, that the composition CBD plus THC were found more effective than each of them alone. And also that it was found that when, depending on the dosage or the ratio as well, but that in this preparation, observed THC could antagonize the narcotic effects of, CBD could antagonize the narcotic effects of THC, and THC was still boosting the activity to restore cognitive deficits. And I would like to skip, sorry, we'll put this up so you can read more. I would like to skip directly and close on this one, which is, we went from in vitro, the cells, and we went to the animals, and then we finish, and this is a work. Thank you, Fabrizio Pamplona, if you are with us, a neuroscientist from Brazil. This is a work from Brazil of a case study on a patient with Alzheimer, where really what's been used is a composition of microdosing cannabis oil, microdosing. At the end, and again, happy if you wanna read this afterwards. At the end of their therapeutic decision has been to give this man 500 microgram of THC per day. This has been after many months of adjustment of his dosage. And I find it really, really interesting because with this dose, this is the results that they obtained: alleviation of Alzheimer's symptoms, cognitive and memory improvement, and everything was fine. The imaging said like nothing was altered. Okay, there were no significant side effects. At the beginning, there was a slight drowsiness. Fabio was commenting that during the interview done to Dr. Pamplona that followed this case study, he was mentioning that there was a sort of like reversal of the pathology. The pathology could not be visible, and it seems incredible with doses like this low, but apparently that was the right amount for this person. Now, I see Fabio is entering. Thank you, because we also touched this topic on a sort of like protocol on our book, and we did touch as well on a protocol for elderly, where indeed, I mean, the dosages were different from this one, but there was anyway a tendency to go in really tiny, like where less is more. And this is, I think, one of the best occasions where we see less is no more. Sorry.
Yes, thank you, Viola, for this very insightful presentation about Alzheimer, and especially this last clinical study that you proposed, because it's very interesting the fact that microdosing is effective, and we are starting to see that microdosing can be a new strategy to treat a lot of pathology, because we don't know why until now, but it seems that microdosing is somewhat more effective of higher doses. This is maybe because physiologically the endocannabinoid system is locally and temporally organized, and so with microdoses we can go just in the part of the brain of the human body that we want to touch. Anyway, I want to also remember that everything that Viola discussed is present in our handbook, Principle of Clinical Cannabinology. You can find what you need to know about medical cannabis and Alzheimer, and also other disease, almost all the disease where medical cannabis has proven to be effective. Thank you for being here with us, and see you next time.
Thank
Goodbye.
you, Fabio. Bye. See you next week.